USMLE style question on Menkes disease. Question: a 4-month-old male infant is brought to the clinic due to failure to thrive, hypotonia, and developmental delay. Physical examination reveals brittle, kinky hair, pale skin, and decreased muscle tone. Laboratory tests show low serum copper and ceruloplasmin levels. Which of the following best describes the underlying defect in this patient's condition? A. Impaired dietary copper absorption in the intestines. B. Excessive intestinal copper excretion. C. Defective copper transport across enterocytes. D. Impaired ceruloplasmin synthesis. E. Increased copper accumulation in the liver and brain. Answer and explanation. Correct answer: C. Defective copper transport across enterocytes. This patient has Menkes disease, a rare X-linked recessive disorder caused by mutations in the ATP7A gene, which encodes a copper-transporting ATPase. This enzyme is crucial for copper absorption and transport from enterocytes into the bloodstream. Pathophysiology of Menkes disease. Defective ATP7A leads to impaired copper transport. Copper is trapped in enterocytes and not delivered to tissues. Low copper levels impair key copper-dependent enzymes, including lysyl oxidase, defective collagen cross-linking, brittle hair, connective tissue defects, dopamine beta-hydroxylase, impaired catecholamine synthesis, neurological symptoms, cytochrome C oxidase, defective oxidative phosphorylation, hypotonia, failure to thrive. Key clinical features of Menkes disease: brittle, kinky hair, peely-torty, hypotonia, developmental delay, failure to thrive, seizures, pale, doughy skin, low serum copper and ceruloplasmin levels, progressive neurological deterioration, fatal in early childhood. Why not the other answers? A. Impaired dietary copper absorption in the intestines. Not correct. Copper is absorbed but cannot be transported out of enterocytes. Excessive intestinal copper excretion, seen in Wilson disease ATP7B mutation, which leads to copper accumulation, not deficiency. D. Impaired ceruloplasmin synthesis, also seen in Wilson disease, but in Menkes, the issue is copper transport, not ceruloplasmin production. E. Increased copper accumulation in the liver and brain, characteristic of Wilson disease, which has opposite copper pathology, excess copper, not deficiency. Key USMLE takeaways from Menkes disease: mutation, ATP7A gene, X-linked recessive, defect, impaired copper transport, low serum copper and ceruloplasmin, symptoms, brittle hair, hypotonia, failure to thrive, seizures, fatal in early childhood. Opposite of Wilson disease, which has excess copper, ATP7B mutation.